I can't imagine living without her or her living without me. She's the best. She really is.
That drug addict that they want nothing to do with, that's somebody's kid. Somebody's dad. Oh. Tried to tell myself I wasn't going to cry. It's oh.
I didn't process it, didn't acknowledge it. In fact, it was easier to lean into active addiction so that I wasn't feeling self-conscious over the decisions I was making.
This would be how much cocaine somebody would have to ingest to kill them. This is the approximate number of prescription pills one would have to ingest to kill them. This is the amount of heroin the average person would have to ingest to kill them. Fentanyl. You're gonna have to bring that camera up here real close to see it. This much fentanyl would kill you and I if we split it.
Fentanyl is a potent synthetic opioid developed to be a pain reliever and an anesthetic. Fentanyl is approximately 100 times more potent than morphine and about 50 times more potent than illicit heroin. Illicit fentanyl is produced by the illegal drug market and has been entering our communities through counterfeit pills that look like prescription oxycodone, Xanax, Adderall, and other medications.
My name is Benji.
My name is Zach.
My name is Michelle.
And I'm a person in long-term recovery. My recovery pathway became the revolving door of incarceration, living in survival mode on the streets, to understanding the importance of recovery work. So self-awareness, accountability, integrity, and finding a moral compass to help me continue to believe that recovery was possible for me.
Let me put it to you like this. So you're driving down the highway and you've got a passenger in your car that is going to reach over and yank the wheel as hard as they can at any point in time. And if you're not ready for it, by reaching out or having direct communication with people or transparency about how you're feeling and what you're feeling through, like it's only a matter of time before that person reaches over and yanks that wheel and you can't control it.
I would tell someone in the midst of active addiction that there is help. There's a lot of help. I think that's one thing that kept me sick for so long. My ego got in the way a lot. But I didn't realize that addiction is a real thing and it's treatable. And that it's okay to ask for help. And I would tell them that you're not alone. There's a lot of us ready to welcome you. Mostly just that they're not alone. You feel really alone and really defeated. Even when you're using, it's not right. But that feeling of defeat and aloneness it's a death sentence.
Support is a huge part of being sober. I white knuckled it a lot in the beginning. I had that terminal individuality of, nobody knows what I'm going through. Nobody's been through what I've been through. Nobody feels what I feel. Well, of course, nobody's going to know exactly what you're going through. But through utilizing the rooms of recovery, I sat there and really listened about what other people were going through. And they may not have been through the exact same things that I've been through, but they've been in enough similar situations that what they were sharing through their experience, strength, and hope, it helped me get through what I needed to get through.
Active addiction isn't a place that we have to stay, and there's a lot to learn from the choices that we're making there. to help us find a stronger path that will benefit our lives so that we can live in healthier ways.
It's something that people shouldn't be afraid of. Some of the best people I've ever met in my life are recovering drug addicts, you know? But to try not to have stigma and try to think openly and maybe reach out a hand to people that need it, because that's what people need is a hand.
For me, it's, be loud about recovery, be educated about your recovery, be helpful, a lot of people think that, an addict is always going to be about themselves and not want to help, or they're just a drug addict. You put that box on someone and, you've got to look at the situation of where the trauma come from. We've all been through trauma. We've all been through something that could have turned you into a drug addict, but you had some of the key things that a lot of addicts didn't have, probably loving parents, a safe household to go to. And it takes a lot for people to step back and look at it through the lens of, what can we do as a collective to help make sure that our kids don't go through this,
People, a lot of times they just need a shoulder. They need support. They need, that connection, because it sounds cliche, but connection really is the cure to addiction. I believe humans are wired for connection. I think it's the outside factors that desensitize us of that and make us think we don't need that connection, because humans are pack animals, I think, but be there for somebody, reach out to somebody. I think people would be surprised the difference it makes when someone just says you're not alone and, let's get you some help.
I'd like people that don't understand addiction or relate to that lifestyle to know that their support and encouragement for a recovery process or a pathway is vital to individuals that are struggling with active addiction to feel part of, and that it's possible to recover.
I'm Rosie's grandma, first and foremost. I'm my kids' mom. I'm a mentor. I'm a friend. I'm a daughter. I'm a sister. I'm someone who is trustworthy and safe.
I'm a spiritual leader, a mentor, a recovery coach, and a peer support.
I'm caring. I am genuine. I try to be brutally honest. Pretty transparent.
What would I say to myself about recovery, about some advice about recovery? I would say that it can be done. You just have to face some things. You have to pick some scabs and let them bleed, and then let them heal the right way. I think in the right environment and with the right support, anybody can recover. Anybody. Nobody is ever too far gone.